Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name's Lesley. I live in Kibworth, Leicestershire. I'm 61 years of age. I have 2 children, boy and girl. One lives in South Africa, one lives in Cardiff. And my interests are dancing. I trained as a dancer from the age of 5, and even now I still do 2 dance classes a week, which I really enjoy. And I was diagnosed with bowel cancer last March 2013, was operated on, and now this is my cancer story.
Lesley, thanks for coming in today to share your story with us. I heard from your intro that you've been diagnosed with a bowel cancer. Yes. And there's not that many people actually who've been in to speak with us with that condition, so it's valuable that you're spending this time with us today, and I appreciate that. Right. The first question I've got for you is, how did this come about originally? What symptoms were you having, if any, and how was it picked up?
Well, for about 14 months before I was diagnosed, I was really tired, lethargic, needing to sleep during the day. So I initially went to my GP, who did blood tests, and I was diagnosed very anemic. So that alerted, due to my age, being over 60. So I had various tests, colonoscopy, endoscopy, and they came back clear.
Yes.
So I carried on for a few months and kept going back to the GP. One GP said, it's your age, what do you expect at your age? But I knew, and my husband, we both knew.
You knew something was wrong?
Yeah.
That caused you
from
to
being really active, and I did 2 exercise classes a week. I was finding that difficult. Walking, I love walking. So in the end, I kept going back. They gave me an ultrasound, sent me off for an ultrasound scan. And I had to wait for the results of that. Then I went away for my birthday, and while I was away in Norfolk, I felt really ill by then. I started getting pains in my side, bloated stomach. So I came back, went back to the GP. The ultrasound scans were back, and he said, can you go in the waiting room? And I thought that was a bit strange. And he came back and he said, I want you to go to the infirmary now. They're waiting for you. He said, there's something there. I can only see one ovary. There's something, a mass or something there. So that's how it started. I went in there, thankfully had a CT scan early the next morning, which I'd been asking for at the GP surgery for 14 months. But anyway, I got the CT. 2 hours later, 2 doctors came into the ward, pulled the curtain around and said, "We're very sorry, you have cancer and we're operating in 2 hours."
So you didn't actually know exactly what it was until you got into the medical hospital.
Yeah.
And you'd had quite a lengthy period leading up to that, although when it came to it, you went in very quickly.
Yes, once the doctor realised that there was something wrong on the ultrasound scan, everything happened really quickly.
Yeah.
I was really amazed. The CT scan the next day, early in the morning, and then I was diagnosed and they operated. I didn't have time to think, my goodness, what's happening?
No.
I was operated on 2 hours after they told me. I thought I'd got appendicitis.
Really? Based on your symptoms?
Yes, nobody in the family. There's no history of cancer at all.
I see.
And I led what I thought was a fairly healthy lifestyle.
Yes.
No red meat, exercised, didn't smoke. So yeah,
you were doing all the right things, but it still came on in that sense.
It was a shock to everybody, really.
Now, you had the operation. How did that go? What did they tell you, afterwards about further information about the cancer, perhaps, and also where things were heading at that point?
Oh, it was amazing. I'd always been nervous of going. I'd never been in hospital apart to have the children, so I wasn't. But they were amazing.
Yeah.
I had amazing treatment once it was diagnosed, and I kept asking, when can I go home? Because I'm quite positive and I'm not one just to lay around. And I even said to one doctor, if you don't let me out soon, I'll knot some sheets together and escape through the window. Yeah. I felt as if I just wanted to. It had happened. They'd removed it. They'd said that he'd got it all, and it was all taken out. So I was just ready then to get home, and I did really well. I was out after about 5 days of major surgery.
That was a very quick recovery period.
Yeah, the physio, they get you out of bed. They don't let you lay around in hospital.
They want people to get out these days, don't they?
The first morning, I'm like, no way, you are joking, I cannot. But with the help of the physio, they managed to get me out of bed.
Gave you some encouragement, let's say.
And then, because of always being active and doing a lot of dancing, I mean, I can't say I was dancing along the corridors, but with the help of the physio, I was managing to go up and down the corridors.
Well, maybe that shows you where that previous healthy lifestyle did pay off.
I think it did. I think that's why I got out of hospital so quickly.
Yeah.
And always looking after myself. I think it definitely did help. So yes, I was out. Eventually that day came. I used to pester them, please, can I go now? And they'd be like, no, you've got to stay an extra day. But anyway, the Friday, I think I had the operation. I think it was on the Monday.
Yeah.
Or was it? I can't remember now. But anyway, I know it was about 5 days in hospital.
And then you were back home.
Yeah, and that's when from being looked after by nursing staff who were, I have to say, were amazing and supportive. And then it's just me and the husband.
So one thing the viewers will be wanting me to ask you is how successful was the operation and what did they actually do? Because I know there's a variety of operations from simple to very complex in relation to bowel cancer. Do you know the site of your tumour?
Yes, it was on the transverse colon.
And how successful was the operation? For example, I mean, this is not necessarily just a measure of success, but it affects people's lifestyle. If you have to have a stoma, for example, or if there's any alteration to the bowel habit, there's a variety of complications. So what was the situation for you?
I was told before the operation that I might have to have a stoma bag. And to be honest, at that stage, I wasn't bothered. I just wanted to be well. So I thought, hey, you know, that's not the end of the world. So that's the first thing I asked when I came round from the operation. Do I have a bag? And she said no. And the surgeon said they'd taken the tumour away, put everything back together again, and he said to me, you'll feel so much better than you've felt for years. Because I said how I'd been going backwards and forwards to the surgery. He said, life will begin for you now.
Just skipping ahead, do you believe that was the case in terms of your overall lifestyle?
Oh, now?
Yes.
Yes.
It was a marked improvement.
Well, me and my husband, we both knew. I knew I was ill, and nobody would. It was like hitting a brick wall.
Yes, those pre-existing symptoms were basically improved. But we're skipping ahead because I was asking you about the surgery.
Yeah.
And what about the change in bowel habit or eating pattern or weight? Was that affected either immediately in hospital or later when you returned home?
Well, initially after the operation, the last thing you thought about was going to the toilet. So the nurses did say I couldn't get home unless I had a bowel movement. It was a standing joke. She would have to measure it with a tape with a measure. Not a nice job, I admit.
No.
But and she used to say, any news, anything? And I'm like, no, and I want to go. So obviously they wouldn't let me out until they knew everything was functioning properly. I even used to say to visitors, can you please go in the loo and do a sample for me? Because I'll never get out of. But anyway, after a few days, obviously I didn't feel like eating for the first day or so, but my appetite increased, and yes, I did produce something for her, and I was eventually let out. But yeah, we used to have a joke about that.
Now, did your bowel habit change at all? Because sometimes when you have bowel removed, it changes the absorption of certain foods, particularly high calorie foods or high fats. That kind of thing.
They put me on. I saw a nutritionist, and they gave me a sheet. It wasn't a diet sheet, a low residue diet. It was weird, really. It was opposite to what I'd been having: white bread, corned beef. No porridge, nothing like no fibre, no fruit.
These are all foods that have what they call high glycemic index, which basically means they're very easily absorbed.
Yes.
So it was being kind of gentle on your bowel.
Yeah, to give it a rest almost. They'd want it to. But then gradually, I got back to normal. I mean, obviously there'd be a few. I do like curries and things, and it's not advisable, but sometimes I'd be a bit naughty and have... And
did you suffer with that breaking of the normal habit?
We have 3 toilets in our house, and they did come in useful, and I knew that if I had a curry, I didn't have a lot, that I'd have to be fairly near to a toilet.
So to put it in a nutshell, you had to be careful about what you ate.
In the early...
If you followed the rules, you were pretty much okay.
Yeah.
If you broke the rules, you did suffer a little bit.
Which now and again, we did. I had a nice curry house where we used to go, and they were all very nice, and you'd say, I can't eat a lot. No. So I used to just have what my husband had, and lots of rice, and just take some of the juice.
What about the volume of food in general? Was that very much reduced or pretty much
the same? You can't have a massive meal. It was quite uncomfortable.
Yeah.
But I didn't mind that. It was early days. I didn't expect to be, rushing into 3-course meals.
Yes.
I was just happy to be all. The main thing was I was okay.
Definitely. So that's the message, really, isn't it?
Yeah, as long as I had...
You were concentrating on the cancer being removed and getting back your basic health.
Yeah, I surprised myself. I was quite positive. It was like a roller coaster. I was like, right, okay, and you get in this weird mindset where you just focus.
So it sounds like you weren't too worried or anxious about the specifics, of having the treatment or, going for the operation.
I didn't have time to think because it was so quick. From being diagnosed with the cancer.
Yeah.
2 to 3 hours later, I'd even had food, a sandwich, and they said, well, we have to operate now.
Yes.
So it was, I didn't have, I'm sure some patients might have thing where you've been diagnosed and then you wait weeks.
Definitely, that's
nothing.
much more common actually. And what you're saying,
I preferred it the
feedback, for us as doctors, that if you get on with the process of treatment as soon as possible after the diagnosis, it stops a lot of untoward anxiety happening.
Yeah, I mean, we were both upset, obviously, when you think you have appendicitis or something, to be told you've got cancer, because that was never in my psyche. Because, as I said, nobody in the family had ever had cancer, so you don't think we were all Alzheimer's and strokes and heart attacks
in the family.
In the family, cancer never even came into it. So I was very focused. Once I was like, right, okay, I'll sort this. I was quite positive.
Good. So the operation went pretty well. I've heard that, and that's excellent. But I understand there was a setback actually shortly after you came home. What happened at that period?
Yes, it was about 3 months after, and I was just getting on my feet, walking, trying to get, not doing full exercise, but walking. My daughter came, she lives in South Africa. She came home, and it was a nice family time. And then I started getting quite constipated and a bit of stomach pain. I didn't think anything of it. And after about 4 or 5 days, I started vomiting quite badly. So my husband phoned the hospital and they said, bring her in. And it wasn't like normal vomit, it was quite dark. And so I came back in, and then I had a temperature and I was just getting worse, and they were saying, we don't really want to open you up again, do surgery. So then it was waiting to go to the loo again.
Conservative management, they call
Yeah.
it. Basically resting the bowel,
Yeah.
rehydrating you, and hoping that it's all going to be okay.
Yes, which after a while they realised this wasn't going to happen. But due to the temperature, they said I had sepsis. So they said, we're going to operate. But it's quite a tricky operation, and I have to be honest with you, you might not survive the operation. So I'm wheeled down again to the operating theatre, and I recognised everybody.
Really?
That was the awful thing, where they're like, you look so familiar, and I was laughing. I said, it's me again, do a neat job. Because I thought the scar's got to be opened again, so I'm like, please do a neat job. And anyway, that all happened. Apparently an adhesion, you get adhesions from surgery, and this had blocked.
That was about to ask.
I was just unfortunate, this had blocked the bowel completely, so no matter what they did, I would never have opened my bowels because it was blocked. But that was, I woke up in intensive care, and I have to be honest, it was amazing. I know that sounds a bit strange.
In what sense?
I just felt, it's the most relaxed I've felt in the whole of my life. Everything was done for me. I just laid there. And I've never felt so relaxed. Okay. Whether it was the drugs they were giving me.
It could be.
And I had a fabulous nurse, and we had a bit of a laugh. She said, I'm going to make sure I stay with you, because we used to have a bit of a joke, if you can make jokes about illness. But anyway, we did. We had a laugh. And I was in there for about 3 days. And then moved to, it used to be the old Burns unit, but it was like a semicircle. We all had our own rooms, because by then my immunity had just gone.
Yes.
So I was in there, and slowly, I was in hospital this time for about 2 weeks, which I wasn't very happy with. But then the poor old bowels were a bit iffy then. They had terrible diarrhea. They gave me a commode next to the bed, which wasn't, but after a while, you know what I mean, it goes out the window. I'm alive and it's all sorted, that's all. So that was, and then eventually the doctors was like, you know, try and eat a bit, try and do this, and I did. Soup and cereal, managed a bit of cereal. And then after 2 weeks, I was let home, and touch wood, everything Everything's been fine since then.
Now, how long ago was that you finally came home?
That was last June.
Yes.
Round about the middle of June.
Okay. And since then, have you had any other major complications, or has it been
No,
pretty much
everything's been
improvement since
fine.
then?
Yeah, everything's been fine since then.
Okay. You'd returned home at that stage, but often there's a follow-up treatment that's required, either chemotherapy or radiotherapy. Did you have to have any further treatment?
Yes, I did. I saw the doctor and he said they'd removed, I was lucky, they'd removed all the cancer. It hadn't gone to my lymph glands, but just to make sure, they'd do a course of chemotherapy just to zap, they were his words, just to zap all the cells, just to make sure. So I took on a course of 6 months chemotherapy.
6 months, was it?
Yes.
Quite extensive then.
I could have done a trial, and I still now I don't know. It's a personal thing.
You offered a trial.
I was offered a trial for 3 months. In fact, a few of my family wanted me to do that. They said, "Why go through 6 months?" But I was determined. I thought, if I'm going to go for chemotherapy, I'd feel happier in my own mind if I did the 6 months. I don't know why.
Yeah.
It was just a personal thing. I just wanted to...
Presumably there were 2 different drugs that were offered, one in the trial, one in the standard care.
Yes, there was. But with the trial, you would be monitored, probably more so
Oh, of course, yeah.
than if you were, and there would be follow-up afterwards. But I just wanted to do the 6 months. I didn't want to do a trial. I don't know would I do it again. I'm not sure, but I just wanted the
It's a very
full
hard
6 months.
decision to actually decide whether to engage in a trial or not, because the trial's often a randomized control trial, which means
Yeah.
there's 2 options on offer. And the randomization means you might get option A or you might get option B, and often you don't know.
That's what they said
Yes.
in the leaflet, and I was like,
Now, when you have standard care, the doctor will give you the best treatment that they think you require at that time. So you see how the decision is actually very difficult.
Yeah.
The trial drug may not be totally proven in its success, which is why it's
Yeah.
being trialed. So it is actually, but then again, it's probably the latest thing. So you can see why it's a difficult decision.
yeah, I didn't make the decision. It took me a while to make that decision, actually. I didn't sort of think, oh no.
No.
But no, I wanted the 6 months. And
But regarding the
Stick to
actual
that.
chemotherapy, did you attend on the chemotherapy suite, and was the chemotherapy as a drip or as a tablet?
initially, they put a PICC line into my arm,
Yeah.
which for some reason I didn't really like. I don't know why. It was like, it felt, I had to call it an alien. I don't know. It was okay. I got used to it.
Yeah, so this is a permanent access
Yeah,
to give
permanent.
you drugs during that period.
Yeah. You can't see it. They put a bandage around it.
Yeah.
But you're aware of it
Sure.
all the time. I used to put a plastic bag on. Showering was fun.
And
Just have to wear or stick the arm out the shower.
Yes.
But you, like anything, you know what I mean? You adapt to
do
it.
you remember your chemotherapy regime?
Yes.
What was it, as far as you can recall? I know it's hard to remember all these names.
It was it was called, abbreviated, FU, and they said just remember that. So that was that drug I had. And no, it was fine. Weird symptom though, you couldn't go near the fridge or in a supermarket. You had to avoid the freezer section if you could, because it gave you a tingling.
I see. It altered your
hands.
sensation.
Yeah. But apart from
That's
that,
actually quite a common change into the processing from the neurons in the arms and legs.
I used to forget. I used to go in the freezer to get some food out and go, forgot. It wasn't nothing. It wasn't a horrible feeling. It was just
Some
like a
people have that
tingling.
all the time. That
Really?
change in sensation. Dysesthesia, they call it.
Oh right.
You had a second drug as well?
Yes. They took the PICC line out because of the sepsis I had when I went back in. They didn't want any infection. You very rarely get infection from a PICC line, but they didn't want me to be back in hospital again. So I had tablets,
Yes.
which were amazing because I didn't have to go I just had to go collect them and then bring them back and take them at home. So...
Do you remember the name?
It was Capacitine, C-A-P, Capacitine, I think.
Yeah.
I take a lot of them. There was like 3 massive tablets and then 2 small ones. It was quite a lot of tablets to take. But from then on, I never looked back, really.
Okay. And what was your experience of actually receiving the chemotherapy?
The first time, my husband came with me and then left because they're a bit short of space in there, to be honest. And I'm quite tough, really. Well, I didn't know I was tough until I've been through all this, but I said, no, I'll be fine, just come back for me later. And the staff are amazing.
What do you think of the environment that it's given, the chemotherapy suite?
Oh, it's lovely. Lovely. I mean, it's not like a hotel. Well, no, it is. They're lovely. The staff, obviously, they're trained differently to other nurses. I think you've got to be a special kind of nurse to work in that.
And how many hours did you go for each time?
It was about 2.5.
Because some people really stay a long time.
No, it was about
day.
About 2.5. But the first treatment, I remember, I was like, oh, and I was a bit, not weepy, because you can't, because people are all around and they're like just, you know, being really strong. But I remember thinking, oh, you know, do I really, how's this going to be? But I was fine. Okay, gave anti-sickness medication. I thought, this is a doddle, so I can cope with this 6 months. But after a few days, the tiredness and the sickness
started to kick in.
Yeah. But then again, I got some, not obviously all sickness meds suit everybody, but I got a brilliant one. And I can honestly say, I carried on with my normal life, really. Shopping, tiredness is the main thing.
What, just to clarify, during the chemotherapy, that 6 months, you were able to carry on with your normal life during that period?
You'd get the odd day. I mean, the nursing stuff, you said you might take to your bed. I can honestly say I never took, but that's me.
You resisted it?
Yeah.
Even though you were fatigued?
Yeah, but in the end, occasionally, my husband used to call it the afternoon sleep. I used to watch a bit of daytime TV, have lunch, and then just stretch out on the sofa. And I might sometimes sleep for an hour or 2 hours, and I'd be like, ooh, hi, I'm back, you know, and then I'd be back to normal again.
Did you try and do your regular activities during that period where you're having the chemotherapy?
I mean, neighbours used to say, what are you doing? And I'd be like, no, I'm fine. I love walking. I find it very therapeutic.
Yeah.
So I used to do a lot of walking. I was anxious to get back to my dance class because I used to do a lot of dancing in my youth. She wouldn't have me back until I got a note from the professor. So that was understandable. And to be honest, some days I didn't really feel like doing the Charleston or the jive or whatever. No. But
did you go back then during that period to dance class?
Yeah.
Because that's quite remarkable, showing that early improvement within that 6 months.
Psychologically, it made me feel better.
Definitely.
Dancing, any form of exercise makes me happy. For others, it could be crochet, embroidery, taking the dog for a walk. But for me, it was dancing and music.
Yes.
In fact, sometimes I used to just put music on in the house and do a bit of a jig.
Well, plus you're back in the kind of real world, aren't you?
Yeah.
And doing things that are
mixing
not
with people who necessarily weren't, you know, poorly.
Yes.
Who weren't on chemotherapy. And that was nice just to be, you sometimes lose your real self. You know what I mean? I wanted to be the old Lesley. I was always hankering for how I was before, and you sometimes lose yourself in amongst all that treatment. But no, it was amazing to go back. And people were really good. And she wasn't easy on me. She just used to say at the start of the class, do what you can.
Yes. Please
don't, you know, overdo it.
So looking back on that time, if you were to have to face chemotherapy again in the future, touch wood you won't, but just if you did, could you see yourself going through that again?
Yeah.
You could face it? Because that will give people encouragement watching who have chemotherapy to come.
Well, I know what I'm like now, and I've gone through it.
Yeah.
and hey, I'm okay. The hair thinned a bit.
Yeah.
I used to have hair, didn't fall out,
Okay.
but it did go a bit thin.
Yes.
And I was conscious of it, so I was thinking of having a different haircut anyway.
Yeah.
New lease of life, so to speak. So I just got the hairdresser to do like a short, and I'll probably keep it short now because I prefer it shorter.
Were you self-conscious about the change in your image in relation to the hair?
Not at all. I think the only thing in that time was I maybe lost a bit of confidence.
Mm-hmm.
I didn't drive for a while.
Mm-hmm.
I got so used to the husband being like a taxi service.
Yes.
And driving me around.
Yeah.
And it's probably only now that I'm getting the confidence to get back in the car and go and see friends.
Yourself.
He'd been dropping me off, which he'd never done before. He became a carer.
Yeah.
And I wasn't really happy with that.
No.
So I'm at this stage of my life, and I'm a lot more confident.
That's good.
A lot confident.
After you finish the chemotherapy, then you're in a rehabilitation period where you're trying to get back to, as normal as possible. But it's not necessarily easy to do that. And one important perspective here is the role of others supporting you, who's around, basically. So
Yes.
what did you feel in yourself after the chemotherapy had ended and all that acute treatment had finished?
I had my last appointment with the doctor who said, that's it now, you're all finished. Get out there, enjoy yourself. And I went out and saw some members of staff who I'd seen, obviously you see the same faces, and they were like, bye, that's it, you won't have to see us again. And I burst out crying. I thought, this is weird. I've just been told I'm okay, but it was weird. I felt a bit lost for the first few weeks. Before, you've always got a point of call. You have the phone number if you feel ill or whatever.
That's it.
And now, I was just out there. And I did feel quite strange for a while. I can't say I was depressed.
No.
Slightly anxious. In case anything happened again, which is ridiculous really, because I'd just been told that everything was okay. But still up there, I kept thinking, what if? And every ache and pain, I'd be thinking,
Well, from the medical perspective, it's a mark of success that they can discharge you and you're doing well.
Yes.
But from your perspective, it may seem like, well, who's around now?
Yes, I'd been so positive and on this treadmill of I will get well. My daughter just had a baby in South Africa. I was determined. That kept me positive. And now I was like a bit weepy and not how I should be.
No.
Slightly depressed and anxious. It didn't last long.
Yeah.
And then I got back in the swing of things. I went back to dancing. I do 2 classes a week now. And I think I'm probably better now. Because I was anemic before due to the cancer.
Yeah.
And was feeling really ill. So that's improved. I go out for meals. I've even attempted a part-time job, which didn't last too long, as a courier in the local area, driving around taking people's parcels. But
Really, that's actually quite an intense job.
I know.
High pressure, isn't it?
Yes.
'Cause I
It
know
didn't last very long.
Those courier firms, there's so many. They're
It
fighting
didn't last
against
very
each
long.
other.
Well, I just thought it'd get me out. I didn't really do it for the cash. I just thought, we'd retired now, me and the husband, and I just thought I need probably a bit more. But no, that didn't last too long. But
it's good to hear that you were trying to reach for a role that was meaningful, to get back some, activities that you enjoyed.
I'm still trying to do that now. I'm meeting friends more. I'm going off in the car by myself. Whereas before we were like joined at the hip because he was so concerned about me.
Yeah.
But now I'm independent really. I'm still looking for other things to join. I might do a day class of something. I don't know, pottery or art, anything really. I'm ready to get out there and and do stuff now.
Well, that's good to hear. Now, going back to what you were saying about feeling anxious and worried about what might happen,
Yeah.
did you feel you had enough support around? And if so, where did the support come from for you?
I have to be honest, friends were amazing.
Yeah.
I got the support from friends. And then one day the colorectal nurse phoned me about something, saying you're going to go have some tests. And I said, I'm glad you phoned, because I feel like I don't have a point of calling a phone number. So she's now given me a phone number, and I said, well, I won't bother you.
Yes.
But she said, oh no, always phone if you're ever worried.
So that was the colorectal nurse specialist
Yeah.
who gave you her contact details, so
Yeah.
you could have that in the background if you were worried or anxious about anything.
And that ticked all the boxes for me. That there was that phone. I mean, I've never phoned her.
No.
But she said, Lesley, you'll be in the loop now for the next 5 years. You won't see the back of us. You'll go for blood tests and colonoscopies. And she said, we monitor you, which is what I wanted. I mean, they can monitor me now forever. In a way, that's a good thing.
And did they live up to that? Did they start monitoring you with some regularity?
Yeah, I've had a colonoscopy. I've got to go for a blood test next week. Check for anything.
Now, this is interesting, because are you one of those people that prefers to be monitored and then you reassured by it?
Yes.
Rather than just being anxious that it's coming up every time?
Yeah. It doesn't worry me one bit.
Really?
I'd rather
You'd rather go and get the measure and test of what's going on in your body?
Yeah. I mean, my attitude is there could be people out there who don't know. I mean, I didn't have any outward, so apart from me feeling tired and the anemia.
Yes.
I'd rather know. They can monitor me now for the next however long, next 10 years.
So it's good to hear that you're managing that monitoring regime very well emotionally. You know, it's not causing you undue distress.
No. Personally, it suits me, that does. I'd rather them monitor me.
Yeah.
I mean, it's not every week, but every, I think it's 2 years now before the next colonoscopy.
Yeah, it's very, very periodic, basically. Did you meet any other cancer patients during this time that was somebody you found valuable or you kept in touch with?
No, because I had the chemotherapy, and you'd sit with various people, and you do make friends because you're in the same boat, aren't you? But then when I had the tablets, obviously I was at home. It was quite a solitary procedure. I have met somebody at dance class who has just come back, and we found out that we both had cancer, and it was nice to talk to her. I probably went back a bit early. I went back about 7 months after the surgery, initial surgery. She waited about 15 months, but I couldn't wait. Typical me. I had to go back and see how I got on.
Do you think there's a role, though, for meeting more patients or having that, they call it peer support?
I think so. I wasn't really given any information on that.
It's generally a new thing that's developing in some centres, but the organisation of peer support is very patchy. But there may be sources of help on the internet or, you know, through local groups. And did you look into those at all?
No, it's only now that I've got confidence back, that I feel like I can do that now, and I will have a look. But at the hospital, when you leave, there was no initial, perhaps later on. They were all amazing, don't get me wrong, but there was no. But I should imagine a lot of people, once they've survived cancer, it's individual, isn't it?
Yes.
I don't want anything. I want to move on now. But it is nice to have a talk with people I mean, friends are good. They've been amazing, and family, but they don't really understand what you've been through. But in my case, it was like getting through a day of not mentioning the C word.
Really?
Not thinking or saying, I'd think, oh, that's it. It's been a few days now, and not really thought about.
Yes, it's a mark of success. How much you can allow yourself to be thinking about other things and not thinking about or worrying about cancer.
Yeah.
If you're worried about cancer a lot, those kind of intrusive thoughts, if they're happening many times a day, generally people feel that's too much. You know, they're often at the early stage.
Yes.
But generally, those intrusive thoughts will get less and less with time. And then you find yourself thinking, oh, I haven't thought about cancer in a while. And then it's sometimes a reminder in the news or TV, you know, where you see it. And then it brings back that memory.
Yes. Now, I have to be honest now, in the early days, it was there. I mean, you can't go through something, and you'd be lying if you didn't say you didn't think about it. But to be honest, as the weeks have gone on, it's fading into the background.
Yes.
Now, and I'm getting on with my life.
Excellent. I'm interested to hear also if you had family support, but also what did you choose to tell the family and when? Were they completely involved from the start, or were you cautious about what was told?
Yes. When I was diagnosed, the daughter had just gone to South Africa to start a new life there with her partner, who was South African and wanted to start a business back there. He had been in England for quite a while, so he was anxious to get back. So she went to South Africa, and then not long after that, they informed me that they were having a baby. So I was diagnosed just after they told me. So initially I didn't want to worry her, because we're quite close.
Yeah.
And the son was in Cardiff doing a PhD. And to be honest with him, I kept a lot of it back.
You did?
When I'd had the operation, because this was all done very quickly, within a matter of days.
Sure.
I didn't phone both of them up straight away and said I've got cancer, and they couldn't come and see me, especially the daughter in South Africa. So after the operation, I actually phoned them. I think it was the day after the op, and she was crying, and I was worried because she was early days of pregnancy, and so I just put on this act really for her, positive. I'm fine, don't worry, it's all gone, and I'm okay. And she wanted to come over. And they were coming over in June anyway. So I said, no, when I get out we can Skype. And the son, I just didn't want to worry him, so I just said, I made up some story about having some sort of, I think I said ovaries or something. I said I just had some minor. And then when I got home, I told him.
Right.
I probably should have been more honest, but that's just the way I felt. I wanted to deal with it.
It's difficult to know what to do, and it had been a big rush for you, I think, at that stage where you came in and had the surgery, so there was a lot happening then.
Yeah, and I was still coming to terms with it. And afterwards she said if I'd have told her, if it had happened before she went to South Africa, they would never have gone. Really? Never. Yeah. So...
And how are they adjusting to it now, nearly well over a year later? They're okay. She's been over a few times. Then obviously she couldn't travel because of the pregnancy. And I hope to go out soon as possible. Now I'm well, see my grandson. So, no, she's fine. And the son was a bit annoyed that I didn't tell him more. Yes. You know, he said, I'm not a child, you could have told me, but he was studying. I didn't want it to affect his studies. Okay. And how's your husband getting on with all of this information and the change in lifestyle and, seeing you go through all of this?
Actually, he's been amazing. Even friends say they didn't know he had it in him, really. He's grown up. I know he's 60, but, some men don't really grow up all that. But I can't fault him. He's been with me. He even used to do, when I was in hospital the second time, he did the catheter in the early stages. He used to empty everything, help the nurses out. They were quite upset when he left because he was like a little helper. And he stayed with me quite a bit. They let him stay. Yeah. Probably because they helped him. He was there from about 12 o'clock each day till sometimes 10 o'clock at night.
So he was really hands-on in all of this?
Yeah, his meal was he found a restaurant where doctors used to go, And I don't know whether this is right. He said the food was amazing, but it didn't reflect in the food we got. But he used to
Go down there, yeah.
have subsidised food, so that was his life for 2 weeks.
Really? And did, in the end, do you find he adjusted to you coming home and getting back into the swing of things? Was he able to do the same? In other words, support you through that rehabilitation period?
Yeah, I would never have thought it. It's only at times like this that you realise how people are going to be.
Yeah.
But friends were good. They'd ask, they'd go, and how are you, David?
Yeah.
They'd put him, I suppose it's like when you have a baby, when the wife has the baby and all the attention is on her, isn't it? And then they get left. So people, it was like that in a way. He was sort of not left out, but he was amazing. His cooking wasn't amazing. His basics were like egg and oven chips, but neighbours, that's another thing.
Did he have to do more then?
Yeah.
During this, that was clear. He had to do more because of helping you out.
Yeah. And neighbours were amazing as well. People who used to just there was like a food brought round, casseroles, and people. A very sense of community. That's not changed now. I know people more in the street.
You must have had good links with them before you ran well.
I did, but then word of mouth.
Yeah.
And then people say, "Oh, I've baked extra. Do you want this?"
Oh,
and
that's brilliant.
it was really good, which helped him a lot. They knew that he wasn't the most brilliant cook.
Yes.
But we managed, and I wasn't bedbound.
No.
I'd show.
But it's nice that you had that sense of community spirit, because it gives you encouragement. Others are interested.
Oh, yes. Oh, it was amazing. People I hadn't brought flowers round. And even now, you know, I've made friends with people who further up the street, not immediate neighbours. But no, my husband was amazing. Has it brought us closer together? Probably. Now he says I'm back to my usual grumpy, obnoxious self. So you know you well. I mean, when you don't feel well, you're just quite passive and just sit there reading a book.
Yes, the relationship can change while the roles have changed. You know, he's more of a carer and you're more of a patient, even at home. But it sounds like you've regained your previous roles and you're back, in terms of the relationship, you know, dynamic to the way it was before, which is...
Oh, yes, completely. He sometimes wishes for the quiet. I do talk a lot, and I think I drive him insane with that. But he often says, "Oh, in the old days, you were like a lot quieter." Not that he wants me to be ill, but we laugh and say, you know, I used to sit there quietly reading a book. But no, I can't fault him. You do need that support.
Yes.
From friends. Probably I didn't have so much family. I'm an only child, and he is as well.
Yes.
So there was no sister-in-laws or sisters or brothers, which I'm sure is very nice, helpful for people. But no, we managed. We've got some good friends, and yeah.
So you've come through a lot, really, when I hear your story from beginning to end. How much back to your normal self do you feel you are now?
Oh, a lot better.
Nearly all the way back to your normal self?
I still feel tired occasionally.
Yeah.
I know if I've done a lot during the day.
Yeah.
But that's a bonus because I can sleep, you know, it means I get good night's sleep in the evening. Occasionally, perhaps once a week, I might have a bit of a rest in the afternoon. We're trying to sell the house at the moment, which is probably not a good thing to do. So we've had loads of viewings when I was in the throes of chemo.
Really?
And the agent likes us to leave the house. So there was a lot of walking around the village while people, and I still did it. I say to him now, you know, I was so ill at that time. And I said, I think I did amazing. And he said, yeah, you did. You know, I was. So we're trying to sell the house. That's the next thing to look forward to and move on. And
so you're still making plans for the future?
Yeah.
Has it altered your view of the future at all?
Yes, it has actually.
In what way?
It's not a dress rehearsal. No. Live life try and... We retired and we were a bit sort of, you know, pottering and not doing much. And we still went on holiday. I still enjoy holidays, but I think it's given me more. I'm going to look for things to do, and not an evening class because I do dancing, but something during the day, whether it's voluntary maybe.
So it sounds to me like your outlook could actually have changed almost for the better, like something good might have come out of this whole thing. Is that fair?
Yeah, that's true. I was sort of happy pottering about and not doing a lot really once we retired. And now I feel like I've been given a new lease of life, really.
So do you feel positive about the future?
Oh, very much so.
Well, that's good to hear.
Yes, very much so.
So despite, having gone through all that and having the cancer diagnosis, which is, okay, it's treated, you can still view the future in a positive way, still make plans and still look forward?
Yes, I feel like, in a way, I'm lucky the most. It was in the early stages. There must be people out there.
Yes, all different stages.
Who are not feeling too well and don't want to go to the doctors even.
No, but some of the things you're saying apply even in different stages, which is to try to look positively and to try to do more rather than less.
Yes.
And to when you did venture out and experience things, you generally felt better for it, I think.
Oh,
from what you were saying
definitely.
before.
Definitely. I mean, you could quite easily just stay in and think, oh, woe is me, I've had this. But I feel like I've been given a second chance. I can't praise them enough for it. I mean, yeah, I've survived it. Fingers crossed.
Yes.
Hopefully, touch wood. And yeah.
Thinking of a new patient watching this now who's at the beginning of their cancer journey, is there anything you want to say to them directly?
Yeah, try and be positive. I know sometimes it's not easy to say that. Not everybody's, happy. I laugh I had a sense of humour. I mean,
kept that throughout.
Friends say, I never want cancer, but if I get it, I hope I've got your attitude.
Yes.
I don't know, perhaps it was a front, but it kept me going. I had to see a joke in. Sometimes we used to laugh. I've laughed with nurses and odd things that have happened.
So try and keep your sense of humour and personality.
I've always had a sense of humour, and I think I don't know, everybody's different, aren't they?
They are.
But there's lots of us out there who've had cancer and survived it.
And is there anything you want to mention about accessing support or?
Yes, the hospital have been amazing, but looking back, I think probably advice on discussion groups, leaflets, or put you in touch with somebody who'd not necessarily had the same cancer as you, but who'd had cancer. I mean, just to meet up occasionally, or over the phone, maybe.
You think that system could be better organised than it is now?
That's the only thing I would say. Did I expect that at the time? I don't know. I was just so pleased that I was well. But then once I got home, and then you sit and think what you've been through.
Yeah.
And you think, my goodness, and then when I think there's the time to meet up with different people.
Definitely.
But no, the treatment was amazing. It can be a bit grueling at times, but you get through it, hopefully, and here I am now, feeling very positive for the future.
Excellent. Well, I want to thank you for coming in today and sharing your story with myself, Heather, and the viewers as well. That's been a very very inspirational story. I think you've been through ups and downs during that. Particularly, I'm thinking of that recall to hospital with the adhesions that came out of the blue. And your initial diagnosis wasn't straightforward either, because you had a delay getting attention. But once the concern was raised, at least recognised by the GP, then eventually you did get surgical treatment quite quickly, and that reduced the anxiety at that time. But you've also fought hard to get back your function, I think, and you've succeeded that by all accounts. You've really got back to nearly normal, which is exactly what people are after. So the fact that you can have this diagnosis and then come as far as you have in a short period is a testament to you, but a good lesson for others watching. So thanks again for coming in.
Oh, thank you. I hope it helps.
Definitely.
If I help just one person out there with this, I'd be happy.
Yes.
Thank you.
Thank you.